Thank you. Oh, that was fantastic. Fantastic. We have time now for discussion and for questions. So get onto Slido, get those questions. If we have any questions from the audience. I just want to make a couple of comments. We talked about complexity, and I think you've shown, all three of you, the extraordinary complexity that's involved here, and that you've talked about, the three of you talked about the dimension of time, the dimension of geography and place, the fact that things differ antibiotic by antibiotic. They differ across all the species, including human beings, that things change depending on what measurement system you use, what type of test you use, what you test, where you test. You brought in the whole One Health picture. Are there any questions from the audience or from Slido? Because I have some, but...
We'll grab some from the audience here.
Yeah, I wasn't sure how to put this into Slido. I'm Sarah from Center for Science and the Public Interest. I had a comment for Dr. Ritter and then a question for Dr. Morley. The comment for Dr. Ritter is I think pork and beef might actually have a leg up on chicken for one aspect on RWA, and that's that they allow for individualized treatment of the animals. And there's pork, for example, pork RWA programs where the contract farmer is reimbursed the same amount regardless of how many pigs break from the program. And that really takes away some of the undue economic pressure not to avoid treatment. And I think that's helpful for those programs. And I'd encourage anybody who's considering implementing a program like that to put something in place to make sure that the animal health decision isn't impacted by the financial decision on the label. And for Dr. Morley, one of those links in the chains, the connection to humans, I think some of our strongest evidence of that involves having outbreaks of illness and then actually being able to trace those all the way back to the farm animals. But unfortunately, what we've seen repeatedly is that public health efforts to do that have been too often obstructed by industry. And there's, for example, APHIS had a program in the 80s that tied a salmonella outbreak back to dairy cattle. Shortly thereafter, the agency, that program was defunded. We also, I think, the New York Times article involving a pork outbreak where industry really pushed back against efforts to test on farm for that. And I was just wondering, what, from your perspective, why has industry been so resistant to that, and what can we do to change that approach so that we can get that better data for that final link in the chain?
Great question. I think that. So I'll just say that, I think that it's clear that we can find resistant organisms, we can find resistant foodborne pathogens that are transmitted from animals to people. And I don't think that's the question. That's why we have one of the most effective control systems in place from a regulatory perspective. That's why people have worked so hard on a production side of it to decrease the occurrence of those pathogens, whether they're resistant or not. As it relates to this question, I think there's a problem with the idea that if we find a resistant organism in an animal, that the anthropogenic hypothesis fits, right? That we caused that organism to be resistant through use of antimicrobials in that animal, right? So it's a disconnect, I think, between the question of how did the foodborne pathogen get there to the question of how did that pathogen become resistant, right? And I think that there has been a bunch of pressure on specific instances, not all controls, not all control strategies, not all investigation strategies, but if you start saying that if you find a resistant organism, it's the producer's fault, right? That's, I think, perhaps the reason why there has been pushback from some of the producers about this. I don't think it's a pushback from the standpoint that they want to make sure that if there's a pathogen that's entering the food supply to people, that they're not concerned about it, because that's not, in my experience, that's not the case at all. And so that if there's an association between causing a health risk to people from the pathogen, then then I believe that it's that connection to the assumption that they cause that animal to have resistant bacteria. That's my perception anyway.
Don, thanks for the presentation. It was very interesting. So you talked about decrease in antibiotic use. So what can we learn other sectors in animal health from the great work that the poultry industry is doing? What would be a message that you can deliver for us to learn about better use, better stewardship?
Well, okay, I think that's a good question, and I don't mean that reductions in users are necessarily better. I think we need to be responsible users, right? So say in long-lived animals that that we're going to put cattle we're going to commingle cattle in a rail car. We're going to send them to a feedlot far away, right? So it becomes nuanced. It becomes prevention versus metaphylaxis, right? Like that group of animals is at risk, highly likely to have a disease problem. So, you say, well, that's prevention because they're not sick yet. Well, it's really not. It's really metaphylaxis because they're going to get sick, and we know this from practice, right? So, but do we need to use a highly critical, important antibiotic to humans for that administration, or can we use the ladder approach, right? Should we kind of ladder down? I think in the long-lived species, we're going to have to ladder down and save the critically important ones for individual animal treatments when they need it. But mass administration of the HCIAs, I think, we got to find a way out of that, I think, in the longer-lived species. So I think that would be my comment would be to kind of use the ladder approach. And we need some studies on this, it's, to me, again, I'm just a chicken guy, right? But dose and duration are supposed to affect resistance, right? So do we need to administer something continuously, or can we pulse it? And we need some research on that. Does it make a difference in the resistome? I think Paul's work on time versus use is very interesting. It just seems like these AMR bugs are more suited to outcompete the other bugs over time, which is intrinsic resistance, and we mentioned like Paul, like you said, that just because you find a resistant bug in an animal, in a food animal especially, it must come from resistance. Well, a lot of the multi-drug resistant bacteria in some salmonella isolates, they're resistant to drugs that cannot be used in chickens, right? Have never been used in chickens, but yet they're on the bacteria. They're part of the resistome. So, so anyway, so that's how I would answer that.
So one follow-up question to that was off Slido. You mentioned prevention, putting on the rail car, and those types of things. There seems to be some confusion around prevention, control, all these definitions. Would you guys like to speak to those definitions and how they're applied?
Yeah. So I'll try. So a lot of people have written those definitions. In fact, I think the AVMA just wrote some new ones, right? And other countries have written those and groups. And, I include control to be infected animals. Okay, so they're not showing disease yet, but they're infected. So say you have a mycoplasma vertical shed issue going on. Like those chicks are infected with mycoplasma. And in 3 days, they're going to start dying. Okay? So I got a choice: is I can wait for them to start dying, or I can inject something in the egg and stop it. Like that, like those eggs are infected. It's inside the egg, But some people are going to say, well, that's prevention. But I don't believe that, because I think we've got an infectious agent on board, and it moves into the control box. But it becomes very nuanced, and I know people want it to be black and white. they want a line. It's a very blurry line.
I think the AVMA's paper. Terry Leonbauer's sitting here. He's one of the lead leaders in that. If you haven't seen that paper, please go to that. I think they did a very nice job. He and Dave Smith worked on that very hard. So I would just point to that, and for some of the nuanced definitions, I think they nailed it, right? To Don's comment about what does that mean in terms of when the rubber hits the road, it's very hard to deny the fact that there's been multiple studies. So meta-analysis, right, the highest form of data accumulation, and then our ability to draw off to causal hypothesis, right? Meta-analysis strongly shows that in high-risk cattle that have a risk of mortality in a feedlot, that exceeds 5%, sometimes vastly exceeds 5%. If you give those cattle, all of those cattle, a dose of telithromycin on arrival, it's one of the most cost-effective things in preventing disease, preventing morbidity, preventing mortality. So the trade-off, right, is to say to the producer, this is the challenge that we're in, makes it complex, right, because there are data out there that says that it's one of the most cost-effective technologies for preventing death, preventing health problems, preventing need for additional treatment, right, additional exposures in the population, is to use this, and at the same time say, that's promotion of resistance. We should not be doing that. And yet, when we go to look at whether or not we can document that, then that's not there, right? So this is the challenge, because I don't think the producers. I've never met a producer that wants to produce an unwholesome product, right? I just have never met that. They want to do a good job. They believe in what they're doing to a societal benefit. And so I believe in the theory and the principle of what we're talking about, a decreasing use, and yet then you still have the data that's controlled. Dave Smith has done some really interesting thinking and promoting the idea of systems approach to disease management, and showing that our markets are all messed up because, so doing things to cattle, that we do in a management perspective, so dehorning, castration, okay, important management, vaccinating before they leave the farm and go into the feedlots. We think that's the best way to do these kinds of things. But there's no market incentive, right? And another way to put it, there's no market disincentive, right? The people who buy those cattle from the producer will not pay more, and they don't have to pay more, right? And so it's this really complex system that involves economics, and in order to, it's not the vertically integrated thing in the poultry where we can mandate that stuff. So it's really complex, and it's hard to I hate to keep saying that, because it's just like, to keep saying it doesn't make it a better definition, right? But we have to recognize that the producers are they're trying to use evidence as the best way to manage the cattle, and we're trying to say in a non-evidence based manner, don't do that. And really the strongest driver of that has been market. They can, and so, yeah.
I have a question. So hi everyone, Heather Feller in the National Pork Board. So we represent America's pig farmers across the entire spectrum. So regardless of how they produce, whether it's RWA, conventional, etc., I can say that we put out resources for our producers as they consider transitioning to raised without antibiotics or RWA production. A comment to Sarah. With that said, included in there is kind of understanding who you're marketing to and what their requirements are. So I think you kind of made a blanket statement of there not necessarily being any drawbacks from moving animals into a different stream. That may or may not be true. So, and I think about the theme of this meeting is really communicating the science around responsible antibiotic use. And I guess I wanted to make a comment now and kind of plant that seed for the journalists in the room as well to help facilitate that, so to make sure that we're communicating clearly. We talked a lot about nuance. Also, for our last speaker at the Layman Conference in St. Paul, Minnesota, we had a swine veterinarian give a presentation on natural disasters and how to respond to that. And one of the things is that folks are recycling images from previous hurricanes, and so they're not necessarily related. So it may be in the paper, and it says Florence in the swine barn, but I actually don't think that was a swine barn that you showed, like when I look at the actual footprint. So how do we catch these things for the journalists in the next section? How do we communicate with you? Like, your caption says hog barn, but I can tell just by looking at that aerial image that is not a swine barn at all. Or actually, if you Google hurricane whatever in 2001, that same image is being recycled. So how do we communicate effectively? How do we make sure we communicate that nuance? And then again, I want to make people aware that we do have those resources available to our producers. And at the end of the day, as Dr. Morley mentioned, we want to produce a wholesome product that is safe regardless of how these animals are raised. So we're protecting animal health and animal welfare regardless of that production type. So just wanted to clarify those points. And then post that question for the next session. And if the panelists have any other comments, I'd welcome. Thank you.
Oh, Paul?
So, excellent discussion. Appreciate all your presentations. I was just going to make a comment to Dr. Morley on your slide of the discrepancy between human and animal funding. And so this is just more of a comment than a question. But as part of our advocacy efforts, NIAA has really worked to try and better understand that. And our estimates put that about 60-1 human to any other thing, livestock or environmental, and based on of line item appropriations. And so we would wholeheartedly agree. And there's an added complexity to that not only do we have that discrepancy, but for the purposes of the research that we were talking about today that really focuses on that interface of the human and the animal, we have funding silos that don't like to cross that interface. And so to really move this forward with science, we need more funding, not detracting from the human side funding, but building in appropriate and addressing that disparity and knocking down some of those silos to allow better funding between agencies that focus in the One Health interface. So.
Yeah, I agree with that, Paul. I mean, I appreciate the specifics about that. I'll just add one other comment to that, is that because of that lack of competitive funding from a public source, on my slides, you saw a number of items where we were funded by producers. We were funded by Beef Checkoff, right? Pork Board is the same way. I mean, they're very, very critical to addressing these kinds of things, and yet the skeptics and critics then say, well, that's funded by industry, so you're in their back pocket and you're not doing good science. And you have to be concerned. You have to question. You have to question that, right? I mean, I think you do, right? I think it's an appropriate question, but look at the good science will out, right? I hope. And I hope that folks that might be reporting on this or maybe not as familiar understand that we're using money that we can find to do the best science possible, right? So thank you.
Let me ask you a question. You've made a lot of very important points, but two that I want to focus on. One is, you both said that antibiotic resistance is ancient because microorganisms in the soil use that as a competitive advantage against other microorganisms. The other is that sometimes resistance is found in animal specimens when the antibiotic hasn't been used, and I'm assuming that that's because of plasmid-mediated resistance. The genes are on plasmids to other antibiotics that are transmitted, and it just adds to the incredible complexity that you all talked about. So my question is, and you feel free to answer, can quantitative methods in particular on molecular biology, do you think that can help unravel some of that complexity? What the environment, human, animal, I mean, you presented some information that I think goes in that direction. Yeah. But can we take it to a level that will really begin to unravel this and answer some of the questions that keep coming up, which all three of you posed, which is, yes, there's a relationship, but the quantitation of that relationship is critical, and we don't know what it is.
That's a really good. So we're betting, Dr. Solomon, that we're betting on the idea that molecular tools will help us. So instead of just saying that it's the same type of strain identification that you use for traceback in outbreaks, right? They're looking at the genetics to say whether or not, how related these organisms are, but we're actually going to the gene level because of the potential for sharing of resistance genes. So we are actually so that's part of the molecular approach that we're doing, where we're doing targeted enriched sequencing on all of the resistance genes, and then we have bioinformatic analysis to try and identify profiles of SNP differences within specific genes, or SNP profiles across genes that maybe say we can use for source attribution, or actually documenting the AHA, right? So in the study that we're talking about with doing the feeding trial of humans, you have to be in. I know there's people going to ask me if they can join. You have to be in. Indiana to join that. Okay, but we are actually going to be looking at those SNP differences in genes to try and document specific transmission across those. So, scale of whether or not we have to identify that in a particular pathogen, or whether we can look across the entire metagenome, those are big questions, but we're betting on it.
Yeah, to add to that, like earlier days, like it was so expensive to do the molecular work. In case of if you do the whole genome sequencing, it used to cost 100,000. Now it's $50 for isolate. You can get the entire sequence of a bacteria, and also the microbiome work. So that's why, I said, with this ongoing project, so I would like to look into that microbiome, to quantitative, what are the genes present in the soil sample, or what are the different bacteria, the different array of bacteria, which is changing from month to month. So yeah, we're going to do that thing. Now it's not cheaply available, but it is reachable to do those molecular techniques to determine the origin of isolate. Yeah, definitely the whole genome sequencing, and NC State, we are part of genome tracker program at NC State, and we have facility of whole genome sequencing facility which reports in real time all the sequences to the FDA. So we are part of that genome tracker program. Definitely we're going to subject all these isolates for whole genome sequencing, and we look into what's going on at molecular level. Yep.
So using Dr. Plummer's figures, if we could get you 60 times as much money, you think you could answer the question?
I'd work 60 times harder to try and answer the question. We are applying it. The question of, how the ecology, the epidemiology of these agents and how they're impacted by antimicrobial drugs. It is to try and think at a different scale. It is changing our thoughts. So for example, Mannheimia hemolytica is arguably one of the most important pathogens of cattle, particularly feedlot cattle. And we know that it's a disease-causing organism in the respiratory tract that leads to a death of the majority of the death in feedlot cattle. So not only are we looking at strains and trying to understand those kinds of things with regard to the organism, but we have some interesting ideas we have some interesting evidence that suggests that when these organisms may be exposed to antibiotics, it may upregulate transmission of particular resistance elements. So ICE elements, integrated conjugative elements, and so it may not just be a change it may not just be clonal expansion. It may be, hey man, I'm in danger. Here's my gene, right? So that's part of the whole ecology, and that changes our understanding of how we can prevent disease and treat disease, right? So it's really critical. It's really critical information, not just trying to be defensive about antibiotics and that.
Is there another question? Oh, Amanda.
Hi, Amanda. Hi, Amanda Bedoin, Minnesota Department of Health and University of Minnesota. I just had a couple comments. One to sort of tack on to this conversation of funding and who's paying for this work and how do we get it out there. I'm a co-author on Randy Singer's paper about potential animal health and welfare impacts of NAE, and we've had some trouble getting that published. And part of that is because it's a paper about perceptions, just what you showed on the slide there. We were asking, what are your perceptions about the impact of NAE? So without actual data showing outcomes in relation to antibiotic use on the farm, I think it's difficult for us to concretely share that message that, again, not a black and white issue, but there are times that going NAE might have negative impacts. And so then the second piece of that is, so I live my life halfway between healthcare and animal health, and it's amazing how many people have never thought of the fact that there could be animal health and welfare impacts of not using antibiotics. So to be able to communicate that in a way that people are going to hear, we need to have the science be not paid for by advocacy groups or by industry groups. So we have to figure out how do we collect those data that show animal health and welfare impacts and be able to share that with people in healthcare and the general public to show them what's happening. And then the second comment that I wanted to make again is about sort of this intersection between healthcare and animal health. And the slide about the AMR in equine barns is just, I mean, this is what we see in nursing homes that are high users of antibiotics. Everyone in that nursing home is at higher risk for having colonization with Clostridioides difficile or multi-drug resistant organism. And this is like sort of the nature of having a built environment with resistance. And we don't talk about that a whole lot. And what's the difference between the risk to our patients and the risk to humans, and just, thinking about that healthcare associated impact and where is that intersection between the AMR that we're usually talking about. So the medication pen on a feedlot versus all the other cows on the feedlot. And I don't really have an ask for that other than we don't hear about that much, that sort of veterinary medicine resistome that could have clinical implications for our animal health. So just a couple thoughts.
Yeah, Elliot Dennis here, University of Nebraska-Lincoln. Had a couple questions about what you think about the spatial variation of resistance. I'm sure a lot of the stuff that Dr. Morley did was Southern Plains cattle versus Northern Plains cattle. And also looking at the management practices, both within feedlots and across different feedlots, and how you think that might impact kind of the resistance.
Well, you bring up a really good point, and we talk about cattle as if we look at a beefsteak on somebody's plate and we think it's the same no matter where, and the ground beef study that I mentioned where we didn't find a difference between RWA packaging and conventional labeled ground beef, we did find a location difference by city, right? There was in the microbiome as well as the resistome. And when we have looked at, so one of the questions about the Mannheimia that we've talked about, that we have thousands of isolates of Mannheimia from that longitudinal study, right? Some of the best data about Mannheimia resistance. And yet down in southern cattle, they're seeing this difference in the Mannheimia. And it's a question of whether or not there's a difference geographically in that. Certainly on a microbiome perspective, like if you look across the microbiome constituency as well as the resistome, we see pen effect, geographic effect, we see all of those kinds of things, and it's an important question that we have to ask that we're trying to make generalities about the impacts of drugs and impacts and the problem of resistance, and there are probably microcosms that we have to deal with. One of the key problems, Annette O'Connor, who works here at Iowa State, right? I mean, she beats a big drum about replication of studies, right? I mean, in human medicine, that the best causal thinking says you have to repeat studies, and we don't have the funding to repeat studies. So we need to. So that geographic effect that we see, that spatial thing, is part of the reason we need to do that.
Okay. Thank you. I'm Ogunleye from University of Ibadan, Nigeria. I'm so glad to be a part of this discussion, which is of global interest. You agree with me? And the discussion will be so insightful. Now, just to buttress the issue of complexity of the matter we are discussing, I'd like to bring Nigeria perspective into it and ask a question for possible insights. for the past 12 years, I've been involved with diagnosis, disease diagnosis, and recommendation of antibiotic sensitivity for farmers from the University of Ibadan, apart from teaching. And it's a normal occurrence in Nigeria to see cases, isolates from poultry, from companion animal, whereby after doing antibiotic sensitivity, you discover that the isolate will be resistant to virtually all the available antibiotics. And it's understandable against the backdrop of the practice in Nigeria. The practice is different here, in Nigeria, because there are no strict control over how antibiotics come in, how it's being used. And many times you are left with, what do we do? Where do we go from here? So I'd like to raise that. Would there be people who have been involved in such situation? How should that be handled so that we can get some insight into it?
Well, so we haven't seen resistance in our poultry populations, treatment failures from overuse of different kinds of drugs very often. Now, we definitely see trends. Say in E. coli in poultry, tetracyclines are probably 75% resistance. Sulfonamides, 25% resistance. You know, so we have data that we use for our decision tree, right? If I got an E. coli problem, I got a 75% chance of treating it with sulfa, and I only got a 25% chance with tetracycline. But it depends on my withdrawal time before slaughter and what I can use and when and how it's going to work, right? I think in countries that are less regulated and have more access to all kinds of antibiotics, don't have a treatment history, it's going to continue to be a challenge. I don't have a magic bullet for you other than educating your animal owners about that and say, look, if you use this all the time, when you really need it, it's not going to work, right? So I think stewardship education for animal owners is one thought.
Yeah, I would like to comment on that thing because I'm part of WHO Tricycle project. I'm a facilitator for a tricycle project. I visit most of the African countries as a part of this tricycle project, implementing protocol of isolation of ESBL, E. coli, and antimicrobial susceptibility testing in low and middle income countries. As a part of that, I traveled to Ghana, Senegal, Ethiopia, like Malaysia, Indonesia, and Senegal. So when I go there, so I look into the data, so you'll see like 100%, like 80 to 90% chickens are positive for ESBL E. coli. So if you pick chickens from the market and just bring it back and test them. And same thing with other countries. Even the environment, they're 100%. So we collect like environmental samples from sewage, which is coming out of the slaughterhouse, and also the upstream river and the downstream river, where at some point where they use this for like a normal agriculture purpose. So only thing is educating people on use of antimicrobials is the best thing. So I know in Asia and Africa, there's no strict regulations for prescription of antibiotics. Anyone can access to the antibiotics. So they can just go to the medical store and they can ask for antibiotics. They'll just give it. So I think the education, that's the way to bring down the thing. That's why the WHO protocol is working in low and middle income countries, which was supported by Fleming Fund, first to determine the prevalence of this antimicrobial resistance, so that the policymakers can take decision on usage of antibiotics in low and middle income countries. And I think, as Ron said, the education is the best way to fight against that increase in numbers.
Time for one last question.
So this is just a comment. Then mine will be super quick. So Don Seaver from CDC. Because of all the discussion about money and funding, I wanted to go back to my slides from yesterday for the purposes of collaboration and partnership. So we didn't get a chance to go into it in depth in the work that we do, but we are at CDC, when we receive that AR money, mandated to put a majority of it out the door to work with our partners. So as far as the money that goes to state health departments, there's a couple different programs we have. And one of the things that we're always interested in is how well our state health departments throughout the country work with state ag, for instance, when they're dealing with outbreak situations or investigations. And so, there's considerations and thoughts that how can we advance the ELC program to put more money out into the states and the state partners that they work with for the boots on the ground. And the other thing is, when I mentioned the broad agency announcements, we have, and I didn't get to go through all this, but we've got numerous projects that deal with water and soil. We've looked at flooding. We have different animal species projects going on with pathogens and antimicrobial resistance. And so to say that we are very interested in doing that kind of work and partnering, we try to talk closely with USDA and FDA to look at what projects everyone's doing. So we want ideas. So if you have ideas, there's gaps. If we can help fill that with you, then we invite that.
Thanks. We actually do have time. I'm looking at 3 different clocks, so we do have a little bit more time.
Well, good morning. Ernie Birchmeyer, Michigan Farm Bureau. Thank you for your presentations. Appreciate the information you've had to share. I'm going to come at this from a farmer perspective, because all of this that's being discussed ultimately has to come home to roost somehow, somewhere, sometime. And in our agriculture community, our farmers are sitting on one of the most economically challenging times this year than they've ever faced. And I think we all need to keep that in perspective. All of them out of their control. Everything from weather disasters, unprecedented spring rain, trade agreements that are impacting their ability to move product, and yet we're sitting here talking about additional changes, potential restrictions, and new rules possibly that they might have to introduce on their farms after they've just gone through a major change as it deals with the ability to use the important animal health protection tools that we have. So my question to all of you, based upon what you've learned and as you look forward, have we gone too far, too fast? Should FDA be encouraged to slow down with the next round? And then what has been the impact on animal welfare and animal care on our farms as you've witnessed it with your work? And I know that's a big question and maybe the right question to end on.
So just a quick comment from the poultry side. I think we've swung the pendulum too far, and we're too restrictive in some of our marketing practices, and which translates into production practices, and the animals are suffering. And so we got to bring it back to reality, right? We got to bring it back to a sustainable, ethical program. And I think we're going to talk about communicating that, I think, this afternoon. So that's my opinion. I definitely think we've gone too far in poultry, and we need to do better.
Great question, and I think it's really important that we make sure that we're including the producers in the discussion to the public, right? I mean, the producers they're left out of it, and in many of those discussions. Agriculture is a for-profit industry, and we should not apologize for that, right? I mean, that our farmers should be able to be very well rewarded for producing, for doing what they do, and sometimes, that idea that it's a profit, there's a profit associated with producing food, it's a negative, right? It's a black eye, and I think that's a pendulum that has swung way too far, right? And our public agencies, I do believe, could speak more directly about that. I believe public health could speak more directly about that, and that's a pendulum that has swung too far. I think the organic movement with regard to longer generation animals I think it's really clear. If you think that the idea that we could be mistreating chickens over a 5-6 week period is a problem, then if you look at a dairy cow, right, a dairy heifer that, she's 24 months or 18 months or 19 months before she enters production, and the average lactation numbers are 2, something like that. You'd like to get to 3 or 4 or 5 even. And if they receive any single antimicrobial treatment, then they've lost all of that marketing advantage around the market share around that, right? And that is an incentive for welfare problems. It's an incentive for welfare problems, and we should speak out against that, right? And so, I think not all of the programs are like that. The RWA, where there's an escape clause, right, and that if those animals could be marketed without that they're second class meat, I think is an important issue, and we need to be speaking about those things. I think the FDA has, in my opinion, has acted with some real applause-worthy action in terms of like working with with the feed directive action of that. That was in concert with the pharmaceutical industries, and I thought that was very well done, right, in that regard. And I don't think that there has been sort of mandated, these changes that could be very damaging. So and they hear the public, so they're in a regulatory role and they have a job to do, and I think it's important for society, and I appreciate the way that that's been done, and I think the USDA agencies have also acted well in that regard. So anyway,
I got one additional comment on that is other countries have done it different ways. So in Europe, use of antibiotics is a pre-competitive issue. Okay, so they are not marketing against each other on how they use antibiotics in their system. Here, we weren't that smart. About the only pre-competitive issue left in animal agriculture is food safety. So we don't want anybody getting ill from our products, and it's not good if company A's products are making somebody ill or company's F products are making somebody ill, right? We don't want anybody ill. So we don't go around talking about throwing each other under the bus on food safety. Unfortunately, we are on antibiotics. We're becoming antibiotic use snobs in a way, right? That I use less than you do, so I'm doing something better than you, or it could be just where your chickens are grown versus where my chickens are grown, right? That there's dense disease areas and there's less dense disease areas. You talk about spatial differences in your cattle raising, programs. We did it to ourselves, and there's ways to fix it, but we're going to have to get food buyers and decision makers at retail and restaurant chains to change their paradigm a little bit, change their thought process, because we have swung that pendulum too far.
Any other comments? Otherwise, you take us into the break, sir?
You bet. So give us a round of applause for our panel.